Now for a deep dive on the policy, I'm joined by Dr. Toby Cosgrove, head of the Cleveland Clinic, Neera Tanden, president of the Center for American Progress. She worked with the White House and in the White House to develop President Obama's health care law. And Avik Roy, he's a senior fellow at the Manhattan Institute for Policy Research and opinion editor for Forbes, who advised Mitt Romney on health care. Welcome to all of you. Dr. Cosgrove, let me start with you. Affordable Care Act, is it working?
Well, we've seen several good things happen. It's really started out to decrease cost, and the jury is not in on that yet. And you have to understand that costs are not just about the individual. They're also about the cost for health care across the nation. It certainly has improved.
And you, as a head of Cleveland Clinic, you would know.
Well, we certainly have seen that, yes.
And so you feel like costs have come down?
We are working very hard to bring costs down. We realize that the pressure is on healthcare providers across the country to try and make care more affordable and greater efficiency, and at the same time bring up quality. And we've seen the national quality indicators go up, and we certainly have seen access increased across the country. So the main thing that we're seeing is the jury is not in yet on what we're doing as far as costs across the country is concerned.
Avik?
Hospital costs are going up.
I was just going to say, first year, it's not the doom and gloom that was predicted.
Well, so hospital costs and the underlying cost of insurance for people who buy coverage on their own did go up in year one for Obamacare. It's stable this year from those higher levels. But a big part of what's happening that a lot of people haven't been paying attention to is as more people are on Medicaid and Medicare, the big government insurance plans, hospitals across the country are merging in order to have higher market power to raise prices on people with private insurance and thereby increase premiums for people with private insurance. We're seeing that actually in northeastern Ohio. Cleveland Clinic recently merged with an Akron health-based hospital system in Akron. Now, Toby's situation might be an exception, but in general, these mergers have led not so much to increased quality, but to higher prices. On average, 44% higher prices for things like knee replacements and angioplasty and heart surgery compared to what they were like in competitive markets in the old days.
Neera, you're shaking your head.
Just to clarify, we actually have data on these things, and premiums, national premiums, are coming down. Premiums that people are paying, your out-of-pocket costs are actually coming down. We used to have double-digit increases over the last couple of years. They've come down. It's true that the healthcare system is transforming itself because there is a lot of pressure to bring costs down. There is greater concentration in some areas. Sometimes, and in most of those cases, what we're seeing is that there's better value for the patient. So I'm happy to discuss the ins and outs of particular areas, but as a national trend, we have national numbers, and medical inflation is down, and it's translating into lower premium increases.
Dr. Cosgrove, what's the next metric?
Well, the metrics are going to be around quality, transparency, and transparency around costs. And we're going to see both of those happen over time, and that will bring the marketplace to a real marketplace. We need to have people understand and have a part in how much they are paying for their health care. And we really need to move from sick care to well care, and that's going to require that people get involved in their care and understand what they're doing. And at the end of the day, you have to understand that the health of the country is only as good as the health of its citizens, and we need to work on that hard.
Avik, what would you be advising Republicans to do right now? Do you try to dismantle the law, or do you try to improve it?
I think you try to make changes to the law based on things that you think the president can sign, where there's bipartisan support.
You wouldn't be going for the kill on this?
No, I mean, they're going to have a vote on repeal because the base really wants it. They've made that promise to their voters, and that's fine. But Republicans in the next 2 years really have to start thinking constructively about how to make the healthcare system better. One of those is to increase access to coverage, access to care, but a big part of how you increase access to care is to make it less expensive. The average day spent in a hospital in the United States costs 5 times what it does in the typical industrial country. That's way too high, and it's not enough to just say, okay, we're increasing hospital costs by 2% or 3% next year. We got to bring it down.
And Neera, that's one part of this law that didn't, it really focused on insurance coverage. It didn't focus, it was having a harder time to go after the cost.
Well, we do have national health expenditures that have been lowering, and I think that's in part because of the ACA, but a lot of other factors as well.
Economic.
The economic downturn has had some pressure as well. I think the thing that we have to distinguish is that out-of-pocket costs have been going up for consumers. That's a 10-year trend because employers have been shifting. So I think that's the next area for Democrats, I hope Republicans, the next area to really concentrate on, how much consumers are paying. The law has actually had a big benefit here because premiums are coming down. But people have to, that's a huge issue for all people.
Very quickly.
We have to understand also we're going to have a shortage of doctors and nurses, 800,000 nurses in a decade and another 130,000 doctor shortage, and we have to address that before it gets to be a real crisis.
All right, Dr. Cosgrove, Avik Roy, near Tandon. Little substance with people's Sunday morning breakfast we thought would be good. A little policy wonkish. Thank you all for this.